Hey everybody, it's Dr. Eric Bulkhauer. We're back for another edition of Thyroid Thursday. And today we're talking about why your labs could be lying to you. So your labs tell a story, but they often don't tell the story that you feel, that you don't feel well, you don't function well, you still have hypothyroid symptoms, and you might even have some hyperthyroid symptoms, even though that your doctor says your labs have been normalized with your T4 medication, or in a functional medicine model, somebody may say your labs have been optimized because they've manipulated your lab values into range, but your body feels much different than what they're telling you you should feel. So let's talk about why this might be. Let's talk about the traditional paradigm of thyroid physiology in both allopathic medicine and functional and integrated medicine versus a new paradigm that I propose. When we think about traditional allopathic treatment of thyroid hormone, if you're diagnosed with hypothyroidism, those doctors are looking at your blood levels of TSH and free T4. And if your TSH is high, your free T4 is low, they're going to provide you with more thyroid hormone to bring your TSH back into range. If TSH comes back into the range that they want, they're going to tell you that you're good, okay? Now, in a functional traditional approach, the functional or integrated practitioner is going to have a very similar approach. They're going to look at your T4, your TSH, and your T3 levels and your reverse T3. And they're going to say, not only does your gland not making enough thyroid hormone, so there's not enough T4 in the bloodstream, but there's also not enough T3 in the bloodstream, and it's T3 that's the active hormone. So because you don't have enough T4, we're going to make sure you have some T4. And because you're not converting that T4 to T3, we're going to give you T3. And they assume that if they've optimized the blood levels of T4 and T3, or maybe just T3, depending on your clinician, then they're going to assume that your hypothyroid condition has been solved. That's problematic as well for many people. But the problem with this traditional paradigm is it really just considers what's going on in the blood. And so they're looking at blood values of TSH, T4, T3, and they're saying, hey, if we can manipulate the blood level by giving you a bunch of medication, then that should equate to optimal cellular health, but it often doesn't. So when you think about the new paradigm of thyroid physiology, one that I'm trying to push forward, we have to consider what's going on inside your cells, because it's thyroid hormone inside your cells and tissues, not in the blood, that determine how you feel. Do you feel hyper? Do you feel hypo? Despite what's going on in the blood. So we have to take a look at what's going on in the blood. I mean, in the blood is important, but more importantly, what's going on in the cells and the tissues. And so we want to talk about this idea or concept of cellular hypothyroidism. What is that? That means there's a reduced amount of thyroid hormone, primarily T4 and T3 being the primary active hormone. So we have to have enough T3 inside the cell, whether it comes directly from the blood or it's coming from T4 being brought into the cell and then converted inside the cell to T3. T3 binds to receptors. If there's a reduced amount of T3 inside a cell or tissue that is needed, then we would call that cellular hypothyroidism. And that can affect all the tissues at the same time. If there's a global drop in T4 from the gland, if there's a drop in T4 and T3 in the blood, then there's likely going to be reduced thyroid hormone in the tissues as well. But you can have normally functioning thyroid gland, sufficient T4 and T3 in the blood, but still have tissues that are in a hypothyroid state because of inflammatory mechanisms. And I talk about this in my book, The Thyroid Debacle, and I talk about this on multiple videos. So hypothyroidism, cellular hypothyroidism, is a reduced amount of T3 inside the cells. How it differs from the glandular hypothyroidism? When the gland can't make enough thyroid hormone, then there's not enough in the blood, and then there's not going to be in the tissue. But in cellular hypothyroidism, there's not enough in the cell, but there may be enough in the blood, and the gland may be fine. What causes this? Cellular hypothyroidism is caused by excessive cell stress and inflammation. I talk about that in multiple videos, but I guarantee it's not something that's often being taught to you in your traditional endocrinologist office, and maybe not at all in a functional medicine practice. And cellular hypothyroidism often when we're trying to identify cellular hypothyroidism, especially people who've been put on T3 medication, we can't just look at a thyroid panel. We have to look outside the thyroid panel. We have to look for inflammatory markers, and we have to look at tissue patterns of hypothyroidism. We can look at lipids, we can look at blood glucose regulation, we can look at renal function, adrenal function. We have to look at tissues beyond the thyroid panel, because oftentimes you're on T4 and T3 and your doctor's busy manipulating those blood levels. So we have to look at the tissue indicators of hypothyroidism, not just the thyroid panel. So common symptoms of hypothyroidism, cellular hypothyroidism, what's interesting is they're going to be all the same symptoms you would have with glandular hypothyroidism, but you can have them even when your blood levels of T4, T3, and TSH may be normal. The other thing that you have to take in consideration, a lot of people who have cellular hypothyroidism have both hypo and hyperthyroid symptoms because their doctors are over-medicating them to optimize their blood levels. The connection to the cell danger response, I talk about this all the time. When there's excessive cell stress, danger physiology perceived by the cells are going to downregulate their metabolism. They're going to reduce the conversion of T4 to T3. This is an adaptive response to slow the metabolism and ramp up defense. So if you have an excessive level of stress on your physiology, this is going to result in tissue hypothyroidism, okay? Decreased conversion of T4 to T3. And even in a situation where your functional practitioner says, hey, you're not converting T4 to T3, giving you more T3 may temporarily change symptoms, but it doesn't change the fact that you still have this immune inflammatory process going on, the cell danger process going on, and the cells are going to adaptively decrease conversion of T4 to T3 and adaptively decrease conversion of T3 to T2 to try and slow down the metabolism. Oftentimes trying to fix the serum T3 or the blood T3 triggers more signs and symptoms for people. So what can you do? So in my mind, in my model, the thyroid recovery solution, what do? We identify the person's state. Is the person who's struggling in a homeostatic state like their doctors think they are, or are they in an allostatic state, which is preventing the well-meaning thyroid hormone replacement from working the way we want it to? Once we identify what state, if they're in allostasis or homeostasis, everybody who's struggling is in allostasis. We identify what's contributing to stress load. Is it organisms? Is it toxins? Is it the type of food? Is it leaky gut? Is it their relationships? Is it their sleep habits, patterns, their lack of activity, excessive activity? What are all the things that are contributing to too much stress on their physiology that they can't adapt to that's triggering this inflammatory response? We have to identify that load. Then we need to reduce or eliminate that load. Then we support the shift back to more homeostatic regulation. Many times people are trying to fix a gut while they still have a lot of emotional and life stress and financial stress and infections, and the GI support works temporarily, but it doesn't work long term, and when everybody gets frustrated. It's because they're still in this excessive stress response. We have to lower the overall stress load, and then we can support that shift back from allostatic gut physiology to homeostatic gut physiology, and the protocol supports that shift, and it lasts. Next, we need to monitor and manage the thyroid hormone replacement therapy so that we can allow the thyroid gland to recover. Too many times people are so busy trying to optimize blood levels of T4 to T3, they're suppressing TSH way too low. And when TSH is suppressed really low with medication, there's no way the gland's ever going to recover. There's no way it's going to stimulate more thyroid hormone production from the gland. So we have to make sure that they have enough thyroid hormone to support their basic needs, but not so much that it suppresses thyroid gland production of hormone and peripheral conversion of thyroid hormone. And when we do this, this is how I get my patients to recover, whether they've been on thyroid medication for 6 months or 6 years or longer. They still have the ability to recover their thyroid physiology, but this is the strategy that I use on every patient to help them recover their thyroid physiology, their overall health, and have a reduced requirement for thyroid hormone. And what they do need to take, if they need to take it, works better at a lower dose. If you want more information on this, you can go to my profile and in Instagram, and there's a link to one of my ebooks on why your thyroid medication doesn't work the way you want it to, all right? If you have any questions, put them below wherever you watch this video. And if you need my help, go to my website, rejuvegencenter.com, and schedule a complimentary discovery call, all right? Take care.